Great, thank you very much. So now we have Kim Parsons. Kim is a consultant at Humana. She leads the enterprise health literacy efforts at Humana, serves on the steering committee for the Health Literacy Kentucky, was a member of the National Academies of Medicine Roundtable on Health Literacy from 2013 to 2017. If you would, Kim.
Good morning. Thank you very much for the opportunity to be here today. And so I'll start today by saying what I'd like to share with you. And that is really around how Humana assists our members and their caregivers to be knowledgeable about the recommended cancer screenings that they should be receiving, have a care plan and the right people on their care team to help get their problems attended to embed patient values into their care plan, and to help them get on with life. I'll talk a little bit about our oncology model of care program, and then we'll talk about opportunities for improvement. So I'm using the voices of consumers to frame my presentation today. And so these are quotes from Humana members regarding their experiences with preventive cancer screenings, a cancer diagnosis, navigating the health system after that diagnosis, and shared decision-making and coordination of care. So I recently interviewed consumers about their experiences with preventive care screenings, and most really were aware of the recommendations of when and how often they ought to obtain those screenings, but they really rely on their PCP as the person that is directing when and where they do those screenings, right? Many with a family history of cancer value and see an increased importance of obtaining those screenings and early detection. But for others, this quote really represents the confusion and the perceived ever-changing recommendations of, say, when they should receive a breast cancer screening, et cetera, right? So that's really why they're relying on their PCP and others to help direct them in that care. So at Humana, when we think about preventive screenings and working with our members and associates to make sure that they're obtaining those, we have member-specific education that we're doing. So, it's coming through the channels that members have told us that they want to receive that information through. It's coming from reminders that we're giving their primary care physicians, maybe when they're looking at eligibility of benefits and seeing where maybe that's dropped through something has fallen through the cracks and their patient hasn't gotten what they've seen. And then also through health coaches and personal nurses. If you call our customer service representative, maybe with a question about a claim, they're going to see, Kim, it looks like you haven't had your breast cancer screening this year. Can I transfer you to someone who can help set up that appointment for you to help get you in to that? Can I find, if you don't have a PCP, can I get a relationship with one that's accepting new patients, and get that scheduled for you? So helping them navigate that. We also incentivize screenings, right? So particularly in our Medicare space, we find that is important, right? If I know that I can use gift cards, for food or other things, right? Because I'm going in and getting that breast cancer screening, that also motivates people. And then also we're looking at Humana in your neighborhood events, right? So people don't always pick up the phone when we call them. They don't always look at the mail that we give them. Maybe they look at their myhumana.com account 6 times a year, right? So we know that we need to be meeting them where they are in their neighborhoods. And then also as part of our bold goal, which is to help the people that we serve increase the number of healthy days that they have. So through those types of activities, we're looking for that. So I'm going to give you an example of a More Healthy Days beauty and barbershop tour. Right. So this is a partnership that we have going on in Kansas City, and we're partnering with the and let me just make sure I have this correct, the Black Healthcare Coalition in that area. So we're working with 25 beauty and barbershops in Kansas City on a monthly basis. They're having these educational activities and preventive services, and we make it fun, right? It's not just for Humana members, it's anybody that's coming in there, right? Because, where's Lisa and my Grapevine Health, right? So if I'm whoever's there, right, they may not be a Humana member, and we may give them some guidance. They probably know someone. They're going to go out and they're going to talk to them, and they're going to talk about, the importance of getting this. And so we're using that as a way to get the word out and meet people where they are. We are reaching people in a trusted environment, right? And it includes education on preventive cancer screenings. Our goal, these are being held right now, March through October, like I said, monthly. And our goal is of 1,000 people receiving screenings during that time. So Humana has a strong commitment to design care models that improve experiences for our members, providers, and our associates, using standardized clinical guidelines to promote more consistent and holistic interventions. So what we know is that embedding and impacting the social determinants of health interactions are going to be central to the success of those models. So we have to address those barriers to obtaining screenings. As was mentioned yesterday, if someone's food insecure, if they're more worried about what it is they're going to eat tomorrow, and especially if they're trying to navigate a system and getting appointments with those PCPs and getting those screenings scheduled, often those things can be weeks, months in advance, right, in their life. That's just not what's resonating with them in terms of the most important thing that they're doing on those days if they're worried about food insecurity. Also, loneliness and isolation. We know that 43% of older adults report being lonely. They're 3 to 4 times more likely to suffer depression. They're 2 to 3 times more likely to die prematurely. Again, these people are not focused and maybe motivated in getting out and doing those preventive screenings. So Humana is asking these questions when we do call members or when they do call into us and express barriers to beginning screenings. We're trying to figure out what those barriers are and how are we addressing them for them. Part of that care support also that we provide is guidance from a Humana Care program nurse. And that support includes referrals to palliative care. It includes end-of-life resources, survivorship. And members really are identified for these programs through prior authorization requests, physician referrals, or member calls if they call in to us that we do that. And we've talked here today and yesterday about the financial impact. Cancer is a leading cause of medical bankruptcy. And so guidance on affordably attaining meds so that people can be adherent, right? If we're not providing that kind of guidance and people aren't getting those meds, then we're not having the kind of outcomes that we're looking for. If they're going home to empty fridges, when they're getting out of the hospital, we're not going to get the outcomes that we're looking for. So we need to screen and find out about those things and address them. So, I had an experience with a Humana cancer nurse and got a call from her 4 days after a melanoma diagnosis. It didn't even occur to me why Humana might be calling me at that point, even though, I was fully aware of the program. But as mentioned yesterday, when someone says the word cancer to you, your health literacy goes through the floor, and you don't even think about what those resources are that might be available to you, and you're often not going to reach out to those on your own. So it's important that it's coming to you. So we can, again, get people the very best treatment, but if we're not helping them with those jobs to be done that Heidi was talking about, we're not going to get those outcomes because affordability, navigation, those types of things are going to impede the outcomes that we're looking for. The telephonic outreach for our commercial members that comes from this Humana Cancer program is really about educating the member and really about helping them navigate through their very individual experiences with their diagnosis and their treatment. The average time someone spends in this program is about 100 days. You can go in and out, like, I need you, I don't need you. We have a lot of tools, LifeKeeper tools, advanced planning care guides, et cetera, that follow health literacy best practices that we share with these people. So lots of success stories that I'll let you guys read in the notes. But again, this really addresses, putting care and consideration around the financial impact of these diagnoses, and what is it that the member is most concerned about. Me paying for the care that I need to get or the treatment that I need to get may be trumped. My focus may be trumped on what it is that I'm doing and responsible for in terms of other members of my family. In recent interviews that I did with Humana associates, trying to understand why they aren't obtaining preventive care screenings at the level that we would hope that they would be doing. I talked with a gentleman who said, he just couldn't afford that, and really what he meant was he couldn't afford, knowing about any kind of problem that he had that he would need to treat for himself, because his priority was, his adult son, and making sure that even as he was transitioning out of the workplace, that financially that adult son was going to be cared for. So again, I'll let you look at these other success stories in the slides that you'll have available to you. I want to share just a quick story about a colleague at Humana, who, while she got great support from Humana, the employer, did not receive the same call and support from Humana, her insurer, that I did, in terms of quickly after that diagnosis getting someone that was going to help her navigate and whatnot. And this is a woman who had spent 37 years working in clinical practice and before, and then working in Humana for the past 10 years. She didn't get a call from the nurse. She didn't expect the call from the nurse, didn't remember that she needed it. And what she said when I talked to her was that, if that coordination of care and that support and conversation to help her guide her conversations and her shared decision-making process with her providers. She said, if you're waiting weeks to see people and you don't have answers, you can be quick to make decisions because you want to take action. And so the value of having that navigator or that care manager, someone that can help you through that and make better decisions, is going to lead to better outcomes. This is Sandra and all of her team members from Humana, who drove 4 hours to be with her for just a few minutes so as not to increase maybe infection issue, expose her to anything she didn't need to, and even some of them dressed up as some superheroes, right? Her comment was specific to navigation and the need for integrative care and what to expect in treatment and how to prepare for that, how to prepare for those side effects, how to set herself up for success as she was, navigating this. So we have our oncology model of care program. So this was recently announced this year and is our fourth model of care. It's quality-based oncology program designed to provide more integrated cancer care for members with the goal of improving the patient experience and health outcomes. So in closing, I'd like to talk a little bit about what I've tried to illustrate throughout the presentation, and that is that social determinant of health interventions are key here. We can give people the best treatment that they need for head and neck cancer. And again, if they're not, if we're not even meeting them where they are initially, so that they know to get these, to get screenings, right? If we're not making sure that they're going home and being set up for success after they're out of the hospital and as they experience their care, we're not going to see the outcomes that we're looking for. The reduction of the administrative burden, right? Somebody that understands what's next and is coordinating that and is really working the care team, working behind the scenes leaving the member out of the middle, not asking that patient to be the person that is taking the care plan back to the primary care physician and has someone that's helping manage or navigate medication reconciliation as they go through this process, right? We've got to take some of that work to be done out of the hands of the people who don't have the knowledge or sometimes the resources to be able to do that work. So patient education and assistance programs that promote shared decision-making and making the achievement of patient goals and the best possible health outcomes is the priority. And again, that integrated care delivery. So in closing, at Humana, our bold goal is to help the populations we serve have more healthy days through business and community collaboration and scalable and evidence-based solutions. And so I look forward to questions and further discussion as part of the panel. Thank you very much.